All right. So we are back. Hey, everyone. Thanks for joining us. I'm Dr. Eric Block, your host of our weekly Live with Blocky on I Love Dentistry. And we discuss a topic of the night with a member of the group. And today we're joined by Elizabeth Dooher Anthony. Thanks so much for joining us.
Absolutely. Happy to be here.
So the topic of the night is patient behaviors that challenge us, where they come from, and how to work with them. And Elizabeth Dooher Anthony is RDH CSOM. She's a dental hygienist, oral facial myofunctional therapist, motivational speaker, and published writer. Where are you zooming in from?
Rochester, New York, on the we're 60 miles east of Buffalo on Lake Ontario.
Now, did you always want to be a hygienist? Tell me your story.
LOL, no. I was supposed to be a rock star, okay? And I remember sitting in my all-girl Catholic high school telling the guidance counselor that, I'm going to be a rock star. It's going to happen. And she's like, well, you might want to have a little backup plan. So I'm like, whatever. So I went to college and they didn't have a rock star major at the time. So I graduated from SUNY Fredonia with a bachelor's degree in English with a minor in theater arts. And which got me employed at Pier 1 Imports. And that's where a very nice older man was buying a Charlie Chaplin poster that I liked to hang in his office. And I quite boldly asked him for employment. And he was a dentist. And he said, well, I am looking for a receptionist. I'm like, oh, I have great phone skills, blah, blah, blah. And he hired me. That God bless him. That was Dr. Rosen. That was 1985. And so I did the front desk. And then 1986 went to dental hygiene school. So no, if you had told me I was going to be a dental hygienist, I'd have been like, no, I don't think so.
I think rock star should be a major. They
Absolutely
should include that in the, yeah. So there you go. Pier 1 Imports to hygienist superstar. And tell me about your book. You've written a book. You're a published author. Tell me all about that.
So yeah, so this English degree that I have is actually come in quite handy because I studied journalism and writing, creative writing. Not much of a poet, but so Surdentity is, I can't get it in the program. Here we go. So Surdentity is my book. I've self-published it in 2013. I've had many articles published in RDH magazine. I created a webinar called Surdentity, or seminar called Surdentity that I turned into a webinar. And so that English degree has come in very handy. And actually the theater degree has too, because what better opportunity for performance is there than a literally captive audience all day long? And when I have like little kids and stuff, I do voices. Like I can I'm a little out of the Disney loop, but I used to sing Disney songs to the kids, and I can like totally do voices of, like whatever. And, just to make people laugh and put them at ease. So really, this has been like a wonderful career for somebody like myself who did not ever think that I would be in dentistry.
So what does surdentity mean? Can you explain what that means?
Absolutely. Surdentity is a word I made up. And it's gaining traction. The hashtag is gaining traction. It's a combination of serenity and dentistry, surdentity. So the object is to create serenity in the dental environment. Serenity being, of course, a peaceful state. And that's what it's about.
So it's creating a peaceful state for yourself and for your patients.
Yes. You and I have very similar outlooks on, our professions, wanting to enjoy what we do. My approach is that if I can be peaceful inside and approach my patients in a peaceful, non-judgmental, calm manner, that interactions are going to go better. If I don't react to their provoking behavior, which patients who are afraid can be very provocative. People who are fearful, they a lot of times don't present as being afraid. They present as hostile, belligerent, argumentative, crabby. And what I have found is that if I can keep myself centered and calm as I approach these people, the interaction goes way better for everybody. And the patient has a good experience, and I have a good experience. And at the end of the day, I'm not stressed out and exhausted.
Now, the topic of the night is patient behaviors that challenge us, where they come from, and how to work with them. And you're talking about patients that are fearful. Where do you think a lot of this fear comes from?
Well, it's interesting. So when I published Surdentity in 2013, I was aware even back then of PTDA, post-traumatic dental care anxiety. It's PTSD. So what I realized even back then was that patients come into the dental setting, and it's like a post-traumatic stress flashback. The smells, the sounds puts them back into this feeling of their initial trauma. But once I started to become educated on the airway, that's when the pieces all fell together, and I realized, oh my gosh, it's the airway that's the source of the initial trauma. Oxidative stress. If a person can't breathe, they are going to panic. So that really solidified my, my theory, I guess, if you want to call it that, that, the oxidative stress from not being able to breathe creates trauma. And then, patients want to avoid the trauma, and then they come into the dental setting, the trauma is reintroduced, and the patients react to that. And then we, the dental people, react to the patient's reaction. And a lot of times that reaction is not, it can be, well, people label it rude, but it's, it's not, it can seem rude, but to me, it's more of a affront. That makes sense?
Yeah, and I've had so many patients with, the PTSD that you're mentioning. They had a bad experience as a kid,
Mhm.
and they don't forget it, and it sticks with
Mhm.
them, and they come in, and a lot of times it's a big deal for them to even just to come in. Um, and then now you're also adding in the factor of patients with airway issues.
Mhm.
So that's even compounding. The oxidative stress. You're talking about sleep apnea or lack of oxygen and that type of thing, correct?
Right. If a patient is a mouth breather, which the vast majority of people in Western culture are mouth breathers, and so that's the primary source of oxygen to their brain, and I put a bunch of stuff in their mouth and they can't breathe, they are going to panic. That is the source of the gag reflex, which is, the most thing that annoys dental professionals, on a scale of 1 to 10, the gag reflex, but that's just what it is. It's a reflex. And if I can't breathe, whatever is obstructing my airway is going out. And that's when I came to realize that I was able to stop being annoyed and stop thinking to myself, oh my God, why are they doing this? Why are they trying to, make this job harder? They're not. They're trying to breathe. I have nursing home patients that can't tell me what day it is, but they can tell me about a visit 70 years ago at the Eastman Dental Dispensary on Main Street here in Rochester. That's how those experiences stay.
So a lot of the gag reflex or patients that just can't deal with whether it's a mouth prop or these isolation devices,
Oh
they're
yeah.
trying to breathe through their mouth. And if you think about it, when you breathe through your nose, it just feels like you're just getting such better oxygen when you breathe through your nose and with your mouth. and mouth breathing is a major issue.
Mhm.
So what do we do with these patients? How do we help them?
Well, and in addition to the gag reflex, I've also come to learn about a lot of people have retained primitive oral reflexes. I figured this out in the nursing home when I had patients that would automatically pucker and close as soon as I touched their mouth. And I started to notice it in non-nursing home patients. And that's where you have this, I talked about this at Dentistry's Got Talent, the lip and tongue tango. You get the lip down, the tongue, you get the lip, and it's like, dun, 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 dun. So, but those are, I really think those are related to the inability to breathe through the nose. The patient is protecting their airway. And a lot of these behaviors are not, the patient's not aware that that's what they're doing. I know you've had patients where it's like you could jump off their lower lip, like just you can't get it to go down. A little bit of coaching, having the patient breathe in through the nose for a minute or so, and then instructing them to close the teeth together loosens this up. That orbicularis oris is very much involved when a person is a mouth breather. So if you can relax that orbicularis oris, then you can get in there, you can get access to the oral cavity a little bit better. It's hard. It's really hard doing restorative work.
Okay, now is this part of myofunctional therapy? And can you explain a little bit more about orofacial myofunctional therapy?
Absolutely. Orofacial myofunctional therapy, it's not new. It's the practice has been around for 40 years. And what it is I describe it as like PT for the orofacial complex. The vast majority of people are mouth breathers whose orofacial complex is underdeveloped. Let me show you this picture. Now it looks a little weird, right?
Mm-hmm.
But you know what that is? That is a representation of the tongue. The tongue should be like an oak tree in the center of the orofacial complex, going up and out and balancing these forces that are coming in. Modern humans, because we don't have to chew anymore. So our tongues are underdeveloped. They're flabby, they're out of shape, however you want to put it. They're sitting low in the in our mouths. And in order to what more orofacial myofunctional therapy does is we work with the tongue to get it up where it's supposed to be. Your tongue's supposed to be in your palate. I didn't know that till I went to my first orofacial monk. I'm like, what? It's supposed to be where?
And is this because of modern foods or
Yep,
lack
yep.
of
Modern,
nursing?
yep, not
You can,
all of the above,
mhm.
and I'm noticing it more and more in little kids. They just have no chin. These kids look like Alfred Hitchcock. They have no chin and puffy cheeks, which is really cute when you're one. But in order to have a functional orofacial complex, you want those jaws to grow forward and not down. My idol, Dr. John Mew in Great Britain, him and his son, Dr. Mike Mew. Dr. John Mew is in his 90s, and he came up with the tropic premise in the 70s. He recognized back then that people's faces were growing down and not forward. And I love him. And he's been kicked out of the British Orthodontic Society like 2 or 3 times. And, there's a lot of people that speak against him, but the man is a genius.
Now, ultimately, our tongue should be on the palate, but is myofunctional therapy, have our tongues and lips basically gotten out of shape, and they're now that when we're sleeping, it's fallen back? And
Exactly.
is myofunctional therapy, like you said, PT or exercises
Yes,
to?
it's exercise based. So I instruct the patient in exercises, and then the patient does the exercises, We monitor their progress, and just like physical therapy.
Now, you're also very passionate about oral care for seniors. Tell me about your experience there.
So my very first job ever was as a nursing assistant in 1978. And, I got that job because the nursing home was in the neighborhood. And back then, 75% of the residents had full dentures. People born at the end of the 1800s or the early 1900s expected to lose their teeth. And dental care consisted of taking out teeth that hurt and making dentures. Fast forward 40 years, and these are the people born in the 20s, the 30s, and now so even starting to get into the 1940s, coming into care facilities with mouths full of not just natural tooth structure, but all the crowns. The typical new resident that I saw had crowns on every single upper tooth, most of the lower teeth. And you know as well as I do that crowns need a lot more maintenance than natural tooth structure. So in a nursing home, you got the perfect storm. You have a dry mouth, you have a high carb, sticky diet, and you have neglect, complete neglect. And it's not malevolent. Nursing staff doesn't have the perceived time or the skill. A lot of nurses are frankly grossed out by the mouth. Ew. And I'm like, what? You can have no problem, doing enemas or whatever, but God forbid you should touch somebody's mouth. And, when I was a nursing assistant 40 years ago, there was no certification. There was no training. It was like on the job. So a lot has changed, and nursing home care has gotten much better at preventing breakdown in the perineum. I used to see horrible, horrible bed sores, and that's gotten a lot better. So we know that change can happen. It's just a matter of getting the message out there, and training, education, training, education.
Now, is there actually a certification for myofunctional therapy and for care for seniors in nursing homes?
As a dental hygienist and a licensed professional, that's my training. Myofunctional therapy right now is it's not licensed. So there's several institutions that teach it, that will teach you to be a myofunctional therapist, but and you can become certified through these different programs, but it's not a license. So there's, just like with chiropractors, okay, and acupuncturists, they were looked at as quacks, 30 years ago. But now, because of patient demand, those practices have become legitimate medical care. I know the same thing is going to happen with orofacial myofunctional therapy in the future, especially as, dental people start to collaborate more with medical people. It's really exciting.
Yeah, it's such a growing field, airway management in general, because the mouth body connection is the awareness is a lot stronger than it used to be.
Thank God.
And in nursing homes, you're probably seeing a lot more cases of Alzheimer's than.
Oh yeah, well yeah, and now there's evidence to show that oral bacteria. I mean, I always knew that people with Alzheimer's had a mouthful of bacteria, but now new studies are showing that they're finding oral bacteria in the brains of these people when they're doing autopsies. So that's wow.
Yeah. Now, also, tell me, working in the nursing home setting, is that tough on the body? In your position. I mean, being a hygienist and a dentist, just in general, is a grind on the body. What about working on a nursing home patient?
So, in a nursing home, the places where I worked did have a clinic, and there was a dental chair that was available to treat patients in. However, It's a matter of, you have to get the patient down to the clinic. You have to get the patient out of whatever they're in into the dental chair, which in some patients that's virtually impossible, because in order for them to get into the chair that they're in, on the floor they use a Hoyer lift, so I can't even transfer. So I ended up doing a lot of bending and twisting. When you see a person that's sitting straight up in a wheelchair, the mouth is very inaccessible. And you can see down here pretty well, but to try and reach upper molars, I would have to bend over and twist. And that's why I have a sciatica right now, and I'm not. I had to quit the nursing home jobs because this isn't even the first time I've had sciatica. I had it in 2015, and ended up having a little surgery where they trimmed down the disc, and I worked through that and was back to normal, and then this happened again. So I had to realize that as much as I love this work, I literally can't do it, and it makes me very sad.
And do you think that was related to the bending and the twisting and working in the
Absolutely.
nursing home setting? Yeah.
Absolutely. And I'm guilty of not taking as good care of my body as I should. Yoga and exercise, and I could have done a lot more in terms of keeping myself flexible. I am going to be 60 years old this year, so it's not like I'm a spring chicken, but I could do better caring for my body. And you hear self-care, but that's what it is caring for myself. And so if I could go back, I would do that a little different, probably.
Yeah, I think in a nursing home setting, it's probably a bit different because in a regular clinic, patients, I can direct them where I need them to go. Now, initially, I felt like I was bothering the patient, and I would sacrifice my own body because I didn't want to bother them, and that's so silly because
yeah,
I have to hold this position for 40 years, where they just have to hold this position for 10 minutes. But now I don't do it anymore. I direct the patient where I need them to go, and I actually think patients respect that because I am totally in charge, and I need them to go up and to the left, and I'm not sacrificing my neck or back to unless they really are having an issue with their back or neck and they can't, then I'll accommodate. But most people, they can lift their head and chin up as you need it.
Absolutely.
So taking care of yourself is so important.
It really is, especially us in our profession. Our bodies are our paychecks, so you have to take care of yourself.
That's so true. Now, what kind of advice would you give for a young hygienist, young dental professional that's just coming out of school? What kind of advice would you give them?
First of all, for young people just coming out of school, congratulations, man. We are on the verge of a huge paradigm shift in our profession. We are not going to be tooth fixers. We are going to be the healthcare providers that we are meant to be. And, if you go to an Ayurvedic dentist, they can make a systemic diagnosis from looking at your tongue. You stick your tongue out, they can tell you whether it's your liver, your kidneys, or whatever. You go to a Chinese doctor, same thing. The mouth is the gateway to the body, and it's long overdue for us, for the dental profession, to step up and tend to this area that we know the best. Even ENTs, they know from the pharynx back, but we're the ones who know the mouth, and the mouth, Hippocrates said it. This is not new information. The mouth is the gateway to the body, and that's where, and that's our specialty. So I would tell new people coming out that you have a great future to look forward to if you can stick with right now it's in transition. And I would also tell them that, and I just did a video about this morning. Care is a noun and a verb. Okay, so we have this care treatment that we need, that we want to do. They need it. They need this treatment. And I get them in the chair and I start looking in their mouth and I stop and I'm looking at this tartar and I'm looking at this blah, blah, blah. And I forget there is a human being, okay, attached to that mouth. So instead, in my zeal to do this care, I forget to care about them. And that in Dentistry's Got Talent, the most important atmosphere in any dental office is my eyes to theirs, that 11 inches, here to here. And I have to remember always that this is a human being coming to me, and it's elective. Okay, dental care is elective. And, patients come in, but they're there. And all these groups that I'm in, there's people complaining about the conditions they're seeing in these patients' mouths and these remarks that they're making. And I'm like, but they're there. They're there. So if we have a patient who's there in our care, we can do something with that. And, sometimes I hear these providers say, well, no patient's going to dictate treatment to me. Well, they dictate it anyway. If I hard sell a patient on a restorative procedure that they don't really want, and they make an appointment, what's going to happen? 9 times out of 10, they're going to no-show, they're going to cancel at the last minute because they don't understand. So I know, I'm supposed to create value or whatever, but if that patient doesn't feel like I care about them, I got no shot at creating value. Does that make sense?
Mm-hmm. Absolute. Yeah, that is such great advice, and it's such a great point there. You mentioned your video. Where do we find you? Where do we get a hold of you? Where do we see your videos and everything?
Well, on Facebook, I have Surdentity. You can look it up on Facebook. SER, oh, this dumb filter. SERDENTITY is a Facebook page. It's surdentity.com. Is my website, and you can find me on LinkedIn, Elizabeth Dooher Anthony. So yeah, getting out there. And awesome. So are you. I'm so proud of you.
Thank you.
Dude, you're like an influencer, man.
Thank you so much. And thanks so much for joining me. That was a blast. And we can add all those things in the show notes. And I wanted to thank all the members out there on Facebook that are watching, now, or the recording. We truly appreciate it. And we will see you next week. Beth, take care.
You are entirely welcome. You take care. I'll talk to you soon.
All right. We'll be in touch. Take care.
All right,
Bye-bye.
bye-bye.